Welcome, everyone. Thank you so much for joining us today as we tackle a really great topic. We've got some wonderful speakers with us to help us navigate through a lot of the issues that have come up during this pandemic around access to approved therapies and home health services. So thanks so much for joining us. I think we're going to have some really great presentations and even better conversation. We've got some wonderful panelists, including John Wing, who's a Senior Medical Science Liaison from PTC, Diane Berry and Dan Madden, who are the SVP of Global Health Policy, Government, and Patient Affairs, and the Executive Director of Patient Services at Sarepta, and Lisa Leisman, who is an advanced practice nurse who does education with private duty nursing at Cincinnati Children's Hospital. So we're really thrilled to have everybody with us today. With that, I will mention this is being recorded, so we'll have this as a resource to circle back after today's presentation. And we're also going to open things up to question and answers after our presentations. So if you come up with questions throughout the course of these presentations, feel free to shoot us a message in that chat box in the lower left-hand part of your screen, and we'll get to those, as I said, in the second half of today's presentation. So to start, we're going to hear from John Wing of Ptc Therapeutics. John, go ahead and take it away for us.
Okay, thank you, Rachel. And I want to say thank you to PPMD for inviting me to speak on this webinar. And I also want to thank them for their support and effort that they give to the D&D community, especially during these challenging times. As Rachel mentioned, I'm a Senior Medical Science Liaison at Ptc Therapeutics. And I'm going to tell you a little bit today about PTC, some of the programs we offer, a little bit of an update on the supply of Emflaza, and hopefully find it informational, important. So PPC Therapeutics is a small biotech company founded by Stuart Peltz. It's been established since 1998, and we cover a variety of therapeutic areas, including genetic disorders such as Duchenne muscular dystrophy and spinal muscular atrophy. We are a growing company. We're approximately 700 employees in 18 countries around the world. And so I'm really proud to be part of this organization as we support a variety of therapeutic areas and a variety of patient groups around the world. And so next slide. So PTC has an expanding pipeline through innovation. And as you can see here, we have programs in gene therapy for AAD deficiency. Obviously, we have Emflaza for Duchenne muscular dystrophy. And then Adelearn, which I'll talk about a little bit in a moment, is in Europe for the Duchenne community as well. We also have other products in other areas around the world, such as Tegsedi, Waylivra, that we're currently partnering to deliver alternative splicing technology to the community. So really our pipeline is founded on a diverse therapeutic area platform as well as a variety of innovative technologies. So I don't usually like to read slides word for word, but for this slide, I really want to because this is an important update. So it's a COVID update and PTC commitment to care. So we want to assure patients and healthcare providers that the supply of Emflaza has not been affected by coronavirus. As of this update, we have more than 1 year supply of Emflaza in stock and available for delivery. In addition, we currently have at least 1 year supply of the active pharmaceutical ingredient, or API, ready for production. Emflaza is manufactured nearly exclusively in the United States with ingredients that are, in most cases, already in the country. We are closely monitoring shipping issues in the U.S., which could have an impact of delivery of drugs to patients. We'll update our patients and healthcare providers immediately if challenges arise. With this in mind, we note that while the supply of Emflaza that patients can order at one time can vary, many insurance companies are allowing flexibility in accessing treatment, including allowing patients to refill sooner to support their supply and allowing prescriptions for a 90-day dispense of medication to ensure continual treatment. Patients are encouraged to work with their doctor to consider whether a 90-day supply is right for them. In the meantime, PTC is committed to ensuring continuity of treatment for every Emflaza patient should issues arise. For more information, patients can contact their PTC Cares team at 1-844-PTC-CARES or 1-844-478-2227. Providing safe treatments to our patients is our first priority. We know how important access to our therapies is for our patients and caregivers, which is why we are continually looking for the best ways to serve them. Everything we do is dedicated to improving the lives of patients with rare, difficult-to-treat genetic disorders. For over 20 years, we have been dedicated to providing new, innovative therapies to patients with rare disorders, and we are determined to deliver on that commitment. So along those lines, I just want to go over this history of our commitment to the DMD community in particular. So as I mentioned, PTC has been around for over 20 years, which for me as a scientist who's worked in this area for about 26 years, this is fairly rare that we can have a company that was founded to develop the molecule in Translarna, brought it through clinical development, and is still around 20 years later. So as you can see here, Translarna was identified or discovered in 1998, and through various efforts has been brought through the clinical trial development process. It was approved in the EU initially in 2015 and then renewed in 2016. As an update, we are currently working with the FDA to hopefully bring this therapy to patients in the U.S., and we will update you as we have any more information regarding that program. Also, as far as Emflaza goes, that molecule was approved by the FDA in 2017 and launched in May 8th in 2017 to bring that important therapy to the patient community. Okay. So, improving patient outcomes by delivering best-in-class therapies early in disease progression. So as a scientist and educator, I spent the past 26 years of my career understanding and trying to understand science, and in particular molecular and molecular biology and how it impacts rare disease. So an important aspect of that is improving standards of care. And what that means is through education is trying to understand what is standard of care for Duchenne. So I encourage you to talk to your physicians, ask them what is currently standard of care, what is best for your family. And in doing that, you can also take part in educational programs to increase disease awareness. At PTC as an MSL, I spend a lot of my activities talking to physicians, patient organizations, and other people. Also, it's important to understand the genotype or the mutation that your son may have, because there are some products out there that are specific for particular mutations. And having a good understanding of what that means, talking to your physicians, genetic counselors, will help you. And obviously, earlier diagnosis is important. And so these four things together are sort of at the foundation of what we're trying to provide to the community. Apologize. So PTC is committed to Duchenne and through offering ongoing programs. So two that I really want to focus on are the two in the bottom right. The Peer Navigator program, where we have families go out to the patient community and talk to you about their experiences with corticosteroids and with Emflaza. And then PTC Cares is a patient support program, which I'll talk more about in the next slide. So this is an important program that has two sides to the services offered. There's the patient support services, and then there's patient financial assistance. So we have a group of in-house personalized case managers that are there to help you and support you, okay, through benefits investigations, prior authorization assistance, and appeal support. And on the patient financial assistance side, there's co-pay assistance programs, patient assistance programs, patient foundation support, and bridge programs. And so for more information, again, I'm going to repeat this information because it's important. You can call PTC Cares at 1-844-PTC-CARES, Monday through Friday, 8 a.m. to 8 p.m. They're available to you. Or you can visit the website at ptccares.com. So caring for a loved one with Duchenne takes a team, and it starts with you. But I also want to take this time to say that during these difficult times, you're not alone. You should reach out to PPMD. You should reach out to PTC Cares, your healthcare providers, and other people during these difficult times. So I just want to let you know that we're here for you, and I'm glad to be able to be part of an event such as this. I will end it here to say thank you and just give you again the information for PTC Cares. If you have any questions or concerns, please reach out and ask. You're not alone. We're here for you. Thank you very much. I appreciate your time.
Wonderful. Thank you so much, John. That was some really great information for everybody on the line. We really appreciate having you on today. As a second reminder to everybody, if you guys have questions for John, if you've got questions or concerns about your Emflaza supply as it pertains to the current pandemic, Send those questions in. Use that chat box function. We will absolutely get through as many questions as we possibly can once we get through these presentations. So next up, we have our colleagues from Sarepta Therapeutics. We're going to start with Diane, and then after that, we'll hear a little bit from Dan. So Diane, go ahead and take it away for us. Thank you.
Great. Thank you, Rachel, and thanks to PPMD for inviting us to participate in this webinar. So we know this is a really stressful time for families, and it's made even more stressful because we can't interact and communicate in the ways we are used to, which makes this opportunity to speak with you through this webinar even more meaningful to us. We know weathering crises, uncertainty, managing transitions, these are not new for this community. You are pros at creating new normals every day, and your strength and resilience inspire us. Recently, our CEO shared a video with the community in which he stated that Duchenne does not take time off for a pandemic, and we as a company are not waiting for this pandemic to pass either. Our mission to provide therapeutic options for all people living with Duchenne remains focused, unwavering, and undeterred. You may have seen an announcement yesterday in which we entered into an agreement with the U.S. Army Medical Research Institute for Infectious Diseases, or USAMRIID for short, to evaluate our PPMO technology to treat COVID-19. So we make the compounds, they do the testing. And I bring this up only to say we answered USAMRIID's call and have already shipped the compounds to them. It has not and will not distract us from our core mission to improve the lives of those living with rare genetic diseases like Duchenne. Every day, our teams are dedicating themselves to advancing our Duchenne pipeline and to supporting continuity in care in two areas. First, for people who take our approved therapies, and then also for people who are participating in our clinical trials. And we are attacking this from multiple levels, which is why we have two people from Sarepta with you on this call today. In my role, I have been involved in engaging policymakers and other stakeholder groups to ensure we remove obstacles to continuity of care and treatment, obstacles that may be shared across the rare disease community. Duchenne isn't alone in this. So this can take the form of guidance from federal and state agencies. As an example, I am completely amazed to say that every state has now requested and CMS has granted what are called 1135 waivers in an unprecedented short period of time since the start of the pandemic. So these 1135 waivers allow a state to waive prior authorization requirements and extend current authorizations during the pandemic under its Medicaid programs. It's not a panacea, but certainly a step in the right direction and a positive signal that states are trying to do the right thing by patients. And we believe private payers are too. United Healthcare, for example, recently pledged 90-day extensions of prior authorizations across their various health plans. We are not only working at the 30,000-foot level. We have people working with our manufacturing partners every day to ensure an uninterrupted supply of our therapies and that they reach patients. We have people working with physicians and clinic staff to anticipate and mitigate any challenges that might stand in the way of patients receiving treatment. We have people working with payers. And we have people, and specifically Dan Madden, who's on this call with us today, and his team at Sarepta Assist, who are working directly with families and serving as a bridge to the specialty pharmacies and nursing providers to help navigate around any issues like needing to reschedule appointments, support for reauthorizations, and other issues. I'm going to turn it over to Dan in just a moment so you can hear directly from him and know that we are available to help you through this time. By the end of this webinar, I hope you tell us that we sounded like a broken record. That would be a success. If any of you have logistical concerns or are having issues accessing one of our approved therapies, please reach out to your case manager at Sarepta Assist. This is why they are there to help. And now a few points. With respect to supply, we are able to fully serve the community of patients on our approved therapies without interruption. We have inventory, we continue to manufacture, and we have a robust supply chain. And we have activated plans to minimize the potential for disruption. The majority of patients taking Sarepta's approved products receive their treatments via home infusion. The safety of patients is paramount, and by extension, so is maintaining a safe infusion environment. Our home infusion providers follow protocols that are updated and in line at a minimum with CDC guidelines. And Dan can speak more to this, as can your Sarepta Assist case manager. As I mentioned before, if you run into issues or concerns maintaining the weekly dosing schedule, Sarepta Assist is there to support you as you and your physician make any decisions regarding treatment. Lastly, if you visit Sarepta.com, you will find a COVID resource page that notes the number of resources both within and outside Sarepta. I note this webinar is focused on approved therapies, but Sarepta is also available at the contact information on this slide to speak to you about your clinical trial or other issues at the advocacy email seen here. Importantly, our clinical development programs remain on track. We are committed to you and committed to advancing our therapies with the same drive as ever. I'm going to turn it over to Dan now, who will talk you through our support services and answer some frequently asked questions. Thank you.
Yeah, thanks, Diane, and hello, everybody, and thanks, PPMD, for the chance to talk about Sarepta and what we've been doing at Sarepta. So I'm going to start by talking about Sarepta Assist, our program. So it's a patient support program, and a key point is that we have dedicated case managers. And what I mean by dedicated is that we are aligned by geography so that you'll be assigned a case manager, and many of you, I'm sure, already know your case manager who will be, supporting you throughout. And most of our team has been here since we launched our first therapy almost 4 years ago. So the program, a big part of the program is reimbursement support, which would include doing BIs, PAs, and reauthorizations. And we also have financial assistance programs that are also part of that. What I wanted to talk more about today is our work with our pharmacies around treatment logistics and home nursing. So I'm going to get into some more detail on the pharmacies in a couple slides, but I'll talk about two other positions that are really key along with the case managers. We have educational support managers. We have 3 of those across the country, and they're all nurses, and they many have relationships with the home infusion nurses who come into your home, and they're an excellent resource if you have questions about the drug or any nursing questions at all, and you can be put in touch with we call them SMs, through the case manager. And the other position is patient access manager. Those, and their role is to help when insurance is denied, to help with appeal letters and all the steps to try to get a denial overturned. And I've got our number there at the bottom of the screen. And like Diane said, it would be a broken record. I've got that number everywhere. So please call us if you need any help. Let's talk quickly about the case managers. This is Richard, who's one of our case managers who supports Texas. And like I said, we have a very dedicated team that are very knowledgeable and experienced. And again, the important thing is there that you have one case manager who supports you, but they can back each other up. Like a lot of you, we've had our work life disrupted a bit, and all the case managers are working from home right now. And some are with younger kids or doing homeschooling, and like I said, everything that you're all dealing with in terms of adjusting to work from home. So if you, for some reason, you can't get a hold of your case managers, the others can help you as well. We have 2 Spanish-speaking case managers, and they help out others on the team, and you can see our hours there. We're available 8:30 to 6:30 and our number. Okay, now I want to talk about more about home infusions and how we work with our specialty pharmacies. So we have 2 specialty pharmacies, Orsini and Optum Care, and along with being the pharmacy that dispenses drugs, they're the ones who also arrange for home infusions. And we have a very close relationship, and we talk to each of the pharmacies every day. We have an hour meeting with both daily. So we get into all the details of the cases, and we're able to raise questions. If our case manager talked to a family and the family had a question, that's a great way for us to resolve issues is those daily calls. And the pharmacies, with the nursing, Diane mentioned the nurses follow the minimum CDC guidelines, and the priority is safety. The other thing I wanted to mention, sorry, I lost my notes here. The nurses also go through a daily health assessment, and they should never enter a home if they have a fever, if they don't feel well. So that's a big part of what they do as well. And then using the appropriate PPE, which would include a minimum mask, following hand washing guidelines and the use of gloves. The main point I want you to walk away from here is that if you have any concerns at all about anything going on with the nursing, if you're comfortable, you should talk directly to the nurse. You can also talk to the nurse provider, which would be the pharmacies. But your central point of contact for any of this, if you want us to help, is to call the case manager. So if there's anything that you're uncertain about or you feel uncomfortable with, just call us. And we, like I said, we have a very tight relationship with our pharmacies. We don't want anyone uncomfortable with anything that may be going on. And then back to insurance, this is a difficult time for insurance. As you all know, reauthorizations are always coming due, and the difficulty now in getting in to see MD appointments. So if you have any of those issues, again, please just talk to your case managers, and we can try to help out. We've had very good, response from the insurance companies. Diane mentioned the 1135 waivers and what United Healthcare did. We're finding that insurance companies are being very reasonable and patient-focused during this time, and that we've had excellent results asking for PA extensions if there is any sort of issue with getting in for an MD appointment, which I'm sure is a pretty common thing right now. And other payers, along with United Healthcare, are doing the same and granting 2 to 3 month off extensions when we request. We have a letter, specific COVID letter, that we're able to send the doctors and their staff to submit to the payers, and the pharmacies use that letter as well. And then the other thing I just wanted to mention that Diane already did is we're really talking about approved therapies today, but if you're on a clinical study and you have any questions at all, that's the number you can call, and we have people who can help resolve your questions. So that's it for me, Rachel. Thanks, everybody.
Thanks, Dan. All right, so next up we have Lisa Leisman. She is a nurse who is an absolute expert when it comes to home care nursing, and she's going to share with us some of the lessons learned throughout this whole pandemic and what they're doing at Cincinnati Children's within their home care services to keep patients safe as possible. So, Lisa, we're excited to hear what you have to say with us today.
Thanks, Rachel, and thanks to PPMD for the opportunity to speak with everybody today. So yes, I'm the nursing educator for private duty nursing at Children's Hospital. We do not have any patients with muscular dystrophy, but certainly have other patients with other neuromuscular diagnoses. Many of our patients have tracheostomies, and many are on ventilators, so they are all at very high risk. So how are we keeping our patients safe with our nurses going out in the homes? We have a total of about 65 nurses providing shift nursing in patient homes. And the main way is absolutely daily self-monitoring by our nurses. They're required to take their temperature every day, and they don't have to report that into us, but just as a self-monitoring. And if they have any fever, any symptoms whatsoever, then they are to call. We have a centralized safety number for the entire organization. So if they do have any symptoms or fever, they call into that central line, and we've developed algorithms of response so that everyone is getting the same consistent response. But they're absolutely not going into homes. The other important step of that, of course, is a meticulous hand hygiene. And those are the two main things no matter what. And it's been very fluid, as everybody knows. And we have made several changes along the way over these past few weeks in our PPE requirements and our monitoring requirements based on CDC guidelines in conjunction with our infection control experts. We are not testing all of our employees. I know that's another concern from the home care families out there. Are we testing all of our staff? There just isn't enough testing out there to do that. Again, we're following our algorithms and testing employees with any symptoms. And those employees are quarantined until results come back. So we're being very careful about following all those CDC guidelines. So speaking of that PPE, because there's been so much talk all the time about PPE, and I know PPE is primarily for the protection of the nurse, typically, unless the patient's severely immunocompromised. So initially, we did not have nurses wear masks in homes except where it's already required for certain skills like tracheostomy suctioning, things like that, where it's already required. So we did not do that initially. That was consistent with CDC guidelines, and we were also trying to be very vigilant about our PPE supplies. I know that supply is variable across the country. We've been fortunate that we have had enough, although we had to be a little diligent in the beginning, and we actually did an inventory in all of our patient homes and with all of our nurses to see what we actually had out there. And then we actually changed our practice as far as how do we get that PPE to our nurses. Initially, our practice has been that nurses come into our office to get their own personal supplies. And we changed that around once we got our inventory. And in order to control what we have and make sure we always had enough available for everyone, we then are now sending out PPE supplies out to each individual patient home for the nurses to use out in that home. And that way we are able to monitor and maintain that supply. A couple of weeks ago, when universal masking was then recommended, another change from the CDC as well as from our governor, then we changed our practice to all nurses started wearing masks and goggles during their entire shift. And that was just and we're still doing that today. That is for protection of everyone. Of course, when they go to stop to eat or drink, they can remove that mask and goggles, but we ask them to remain at least 6 feet away from anyone else in the home whenever possible. If any patient or family member in the home presents with any symptoms, fever, respiratory symptoms, we then add the added requirement of wearing gown and gloves for the entire shift, in addition to the mask and goggles. A recent development in the past week and a half is that we are asking family members to wear a mask whenever they're within 6 feet of our nurses. Again, we're trying to be proactive either way to keep a healthy nursing staff that are able to provide services to our patients. They can be cloth masks that the families have themselves, or they can use the ones that we send out to the homes. We also made a change to our staffing model. Our staffing model, we have multiple nurses taking care of multiple patients. So a family who gets 2 shifts a day shift and a night shift, could easily have 10, 12 nurses on their nursing team. When all of the COVID came about, we had another look at our scheduling and our staffing plan, and wherever possible, we tried to then limit the number of nurses who are going to each home right now, again, to reduce exposure. Our cleaning and disinfecting practices have not changed. They are more than adequate for what we do on a daily basis, so we've not made any changes to those practices. We're also making weekly family screening calls. So once a week, our case manager calls each family, checks on the PPE supply, and also screens if there are any symptomatic patients or family members. Some other things we've done to protect our patients is we have suspended routine manager supervisory visits. They'll go if it's needed, if there's a problem or a concern, but the routine ones have been suspended for now. And each of our patients gets a comprehensive assessment every 60 days, which has always been in person. Again, Medicaid has waived some requirements due to all of this, and we're now able to start doing those on a telehealth platform. So again, we're reducing one more person going out to our patient homes. From our patient family side, and I know some of you have probably really struggled with this decision, do we continue home nursing? And that is a very difficult thing to try and balance exposure while providing adequate care for you and your loved ones. We're obviously keeping our patients' families up to date on our infection control practices, and our families have made some of the following choices about having nursing in their homes. Some have suspended all services until the restrictions are lifted or they feel safer to have nursing in the home. Some families suspended day shifts only and kept their night shifts so they could sleep at night. And a few of them have limited their shifts to when only a couple of specific nurses are scheduled to work. Again, limiting that exposure. Many of our families have suspended orienting any new nurses to their homes. And we're supporting all of those decisions. Because of our staffing model, we're able to, move nurses around, and so we've been able to provide hours for the staff, which is another concern, while supporting our families' decisions. Of course, you need to consider what other care support do you have. You can't be up 24 hours a day, so you need to be able to provide the care that you need to your loved ones and balancing out having enough care and limiting exposure. So I'm certain it's a struggle, and I'm sure things can vary from agency to agency, but wanted to share the practices that we're doing for some food for thought. And I think that's all I have to say at this moment. So would love to hear your questions.
Great. Thank you so much, Lisa. I think one of the things that really hit home for me was just how responsive you and your team has been and your institution has been. I think that it's really hard when the recommendations from CDC and other governing bodies change. And it's really hard when the situation is constantly changing and evolving. And I really appreciate the notion that you're all doing the best that you can given the circumstances and really adapting to the change in recommendations as they come and just doing our absolute best to keep our patients and their families as safe as possible. So thank you so much for that really helpful perspective. All right. So at this point, we'll go ahead and open it up for questions. So as I mentioned, there in that lower left-hand corner of your screen, there's a little chat box. Go ahead, send us your questions. I know that you all have burning questions that you would like to ask, and we're happy to do our best to answer as many of them as possible. So go ahead and start sending those in. So this first question, I'm going to go ahead and direct it to John. This is about Emflaza.
Yep.
The question is, we've had a difficult time getting Emflaza for our most recent delivery. Our insurance doesn't cover the medication, and so we're on bridge, and we can't get more than 30 days at a time. It took about 3 phone calls over the course of 2 weeks to get the shipment, and it only arrived on the exact day that he was completely out and due for a dose. What sort of things can we do to make sure that that doesn't happen again? And a quick thank you from the same person who's very much appreciative of the Bridge program as well. What do you think, John?
I really think, I've said this before with the name, calling PTC cares and working with the case manager and trying to be as proactive as possible as you can is the best answer I can give you, I think.
All right. Any thoughts on if we weren't to get our shipment in time, heaven forbid? I know that that's definitely worst case scenario, but what would you advise if a family wasn't able to get that shipment in time and they were potentially to miss a dose?
So I would work with your physician and ask their advice, and specifically I would talk to an endocrinologist is the best answer I can give, I think.
Perfect. And from a PPMD side, so a lot of you know me, Rachel, I'm a nurse practitioner. I would echo that. So work with your prescribing physician, work with your endocrinologist, make sure that you have a plan in place if this were to happen. This, of course, is not ideal, and we've got a great team at PTC Cares who's going to do their absolute best to make sure that this doesn't happen. But if it does, there might need to be some sort of bridging. There might need to be some sort of emergency plan in case. And even now more so that we live in a world that is a bit on lockdown, we would definitely encourage you, make sure that you have the open line of communication, not only with PTC Cares and your insurance company, but also with your physician team to make sure that you do have that plan in case the worst were to happen. All right, so next up, I have a question for our team at Sarepta. So in regard to home infusions, what's the best approach to ensure that your child ensure your child that the infusions and the home nurse are safe at this time. We're trying to get him to allow the nurse in the home for the infusion, but he's still a little bit anxious. Do you guys have any thoughts on that topic? I know it's a tough one.
Yeah, just a couple thoughts, and I'm actually familiar with family and understand the concerns that have been raised. I think maybe the best thing we could do is I know this is an option care case. It might be good to set up a conversation with our program manager at Option Care, who's also an infusion nurse, and she could talk through some of the details of what the nurses do, a lot of what Lisa was talking about in her presentation, just to at least educate on what precautions are taken. Also, a conversation with the nurse who has been doing the infusions might be a way, maybe even a conference call. And then ultimately, it is a tough one if your son is that concerned. It might be hard to make him feel comfortable, but that would probably be the best way. At least get it all out on the table of what precautions are taken and see how that goes.
Yeah, and this is Diane. I'll just jump in and give my 2 cents as a fellow mom, not necessarily in my capacity at Sarepta. But, I think like Dan is saying, it might provide some comfort or confidence just if the child's able to hear what precautions are being taken in the protocol that's going to be used and to walk through it with him in advance. So that might help with any anxiety.
Lisa, I'll actually pose the same question to you, not necessarily specifically to this situation, but I'm curious if you or any of your colleagues have encountered similar situations where perhaps the families or the patients are just really anxious about receiving services, but those services are really helpful and, essential. Have you faced any families like that? And what sorts of things have you done to help support the family through that anxiety?
We haven't really encountered too many families that are anxious about our nurses coming in. Usually they've been on a list waiting to get our services. But as far as this particular child, I don't know how old that child is or the situation. But if PPE is suddenly being used that was not used previously, PPE from a child's point of view is very frightening. You lose that whole visual connection with this person because they're covered in all these, a mask and a goggles or whatever it is, and that's extremely frightening. So, again, I agree with the other people to try and explain that ahead of time. Try and, put the mask on the child, let the child play with that equipment a little bit, the PPE, and figure out that, and talk about it in, of course, an age-appropriate manner that, I'm wearing this because I want to make sure my germs don't get near you. And I'm not sick, but I just want to be extra careful. And those kinds of, whatever you can do ahead of time and with any element of play appropriate to that child's age, we usually find to be really, really helpful.
What great advice to really just meet the child where they are, whether it's a young preschooler or an adolescent, figuring out what's developmentally appropriate and really trying to hone in on that appropriate play to help them get comfortable with these things. Because they're really scary. If you've got somebody coming at you with a mask and you're not used to that, I'm a grown woman, a mom myself, and I would be really frightened by that. So it's a really good perspective. Kind of in that same line, one of the questions is, are you recommending N95 masks for in-home nurses when they're caring for patients? Or what sort of masking are you recommending to make sure that everybody's safe?
I can address some of that. Right now, we are only doing surgical masks. The only our criteria for an N95 for our nurses is that either the patient or someone in the home would either test positive for COVID or depending on what kind of exposure they may have had. Again, it fits into our algorithm. And that would dictate when an N95 would be called for.
Okay.
But otherwise,
Here's a question. Go ahead. You finish first.
Yeah. So the N95s we're reserving for those special, definite circumstances.
Okay. So a question of my own, and I've heard a little bit from some of our community members as well. What if a family requests that their nurse wear an N95 mask or something more protective than a traditional surgical mask? Are you trying to meet those requests, or do they really need to fall within that protocol that's been set out in advance?
For the most part, they really need to follow the protocol. Families can always talk to their provider, or, we would certainly have conversation with them and explain why we're not using the N95s. We have to reserve those for cases where it's definitely present and needs to be there to protect the healthcare worker, in order to ensure that we have enough supplies that when we really need them.
It's just such a hard balance. I know that. Go ahead, Dan.
I was going to say, similar answer from us. Both our pharmacies, Orsini and Option Care, would try to accommodate the request. It's difficult to get those masks right now, and it's the surgical masks are what they're using as well. But really, regarding any PPE, the pharmacies would make an attempt to meet a request. It's just working through some of the shortages now with certain types of PPE, and N95 is probably the best example.
Yeah, definitely. I know it's certainly a source of anxiety for a lot of people, and we want to keep everybody as safe as possible. And it's really hard to, I think, reconcile wanting to keep our children and our families safe and keep our nurses safe, but also keeping in mind the need to conserve those sorts of equipment for people that really are on, at highest risk. It's just so hard to reconcile those things.
Mm-hmm.
So here's my next question. So again, for Lisa, I had a feeling Lisa might be in heavy demand with these questions, as so many of us have home care services for our sons. Are you running out of work for nurses due to families deferring home services? So not having enough work for nurses because families are saying, you know what, we want to hold off on in-home care right now because of the current pandemic.
Very good question. Thank you for that. And yes, we are experiencing that to some degree. Fortunately, because we are part of a large organization, we have some special pay practices in place to help people at least temporarily. There are some opportunities for our nurses to help with our general hospital screening. So any employee that comes into any of our buildings has to go through a temperature check and a health screening. And so there are opportunities for nurses who currently are losing hours for whatever reason. We're experiencing the same issue with our clinics and our ambulatory nurses, that we're trying to provide them those opportunities for working hours.
Again, it's just such a hard balancing act, right?
Yes, very much so.
All right. So this next one, it's not necessarily a question, but maybe expression of a concern. So the story from the person that has submitted this is they have a family who has had to stop allowing the home health aide come into the home because she wasn't being safe. And the concern is with the nurse who is fine, but the aide was ill-informed and not deserving of our trust, and consequently mom and dad are providing health care to their son. So I think maybe this is a question for Lisa and for Dan. Have you found yourselves in situations where you've potentially had concerns or complaints of people in the home not necessarily following protocols that has been laid out to keep everybody safe? And what have you done in those situations, and how have you addressed those really difficult to navigate sort of situations?
I can go ahead and talk about that a little bit. We've had, that I'm aware of, one kind of similar complaint from a parent that a nurse was not keeping the mask on the entire time when she should have, and didn't want her back. And so in that case, we certainly readdressed that with the nurse and reinforced these are our practices and you have to follow them. And we usually do pretty much all the time. If a parent does not want a nurse back, then we talk about that first to make sure we understand why and see if it's something we can mitigate through education or retraining. But ultimately it is the family's decision to not have that person come back to their home. So I think for the majority of our nurses, they're following our PPE requests pretty stringently because it's not only protecting the patient, but it's also protecting themselves.
Dan, is this something that you've had to tackle with Orsini or Option Care at all?
Yes. Thankfully not very many cases of this, but we have had this come up, and I guess my first thought would be just to recommend this would be exactly the sort of thing to call your case manager on, and we can address with the pharmacy directly. But we have had a few questions from families who didn't feel the nurse was properly using PPE or just being as safe as they should be. So same kind of answer as Lisa. We would address that with the pharmacy, and then the pharmacy would then, the director of nursing for that local pharmacy or from the national pharmacy would review the case. And ultimately, if a family really didn't feel comfortable with that nurse, we would find a nurse. We try to always have backup nurses for all of the patients. It's depending on the part of the country you're in. The more rural the area, the little bit harder it is to find experienced infusion nurses. But we would do what the family wanted and switch to nurse if they really were uncomfortable.
That's great. I think it's really helpful to know that there are options available. And as a family, if you are feeling uncomfortable with, the practices that your nurse or home care aide is doing, it's super important to have those conversations, raise those concerns, and come up with a game plan to make sure that if you want to continue to receive services that you can, but in the safest manner possible. All right. So let's see. Okay. Another question that came in is about additional PPE. So what about getting gowns, surgical masks for patients and family caregivers on hand sanitizer, Lysol, things like that? If those are part of the prescribed PPE and we're facing challenges receiving those PPE into the home, perhaps as part of a relationship with a local home care agency, whether it be through the hospital or some private agency, any thoughts on how to best tackle those shortages and supply concerns?
Sure. So maybe kind of a two-part answer. I think to address this individual situation, I'd talk to your case manager and bring up this call even that Dan was on the call and talked about it, because we can try to work with the pharmacy to meet the requests for things like gowns and things like that are certainly easier to come by than N95, and we want everybody to feel comfortable. And then the other thing we are looking into, and we don't have it all completely figured out yet, but I can at least give a preview. As Sarepta, because we, have laboratories and, some amount of PPE ourselves, we're looking at our own supply of PPE, and then we're also looking through our suppliers to see if we can possibly provide things like hand sanitizers and masks, not to replace what the pharmacies do, because the pharmacies and the nursing companies are responsible for that. But we're looking into the possibility of just acting as like a backup service so that we could provide some PPE, just to be some peace of mind that, if for some reason the agency didn't have it, you, as a family, you might have some in reserve. So more to come on that. I wish we had it all figured out. I could just say that we're about to start doing it, but, we know that's a need and a concern by a lot of the families, and we're trying to do something to help in that area.
And this is Diane from here. So Rachel, just want to add, this is Diane from Sarepta. Just for clarity, because we also, in certain cases, have enabled home infusion in the clinic, in the clinical trial setting. And so we have two different routes, two different numbers to call. This webinar is about approved therapies. So definitely if this is a situation with respect to one of our approved therapies and those infusions, then reach out to your case manager at Sarepta. And then on the slide that we presented, there was also contact information if this is an issue in the context of one of our clinical trials. So just wanted to provide that clarity.
Yeah,
thank you.
This is Dan again. Yeah, my answers and the Sarepta team, we're there for approved therapy. So thanks for clarifying that, Diane.
Great clarification. It's easy to get things mixed up because, it could be an in-home infused therapy either way, but those routes can definitely be different depending on the context of the treatment. So thank you so much for that clarification. Lisa, I don't know if you had any additional insight on the use of PPE and the supply of PPE in the home?
So we are not providing any hand sanitizers. We just don't have it. I said we're making sure that we have enough for our nurses who are out in the home, and then we started sending out the additional masks for the families since we're asking families to mask for us.
Okay.
Any additional PPE supplies, we advise families to talk to whatever home supply company they're working with to see if they have any that they provide. I know that our home care is currently not able to do that. We're just trying to make sure that we have the nursing staff protected at all times. So that's kind of the approach we're taking at this point.
Great. And then I think this is a quick clarifying question, again, for Lisa. So when it comes to family members being masked, if they've got the nurse in the home, do you maintain that they would only need the mask if they were within 6 feet of that nurse, or just in general? When would a family member mask?
Thanks. We're only asking family members to do that when they're within 6 feet of the nurse.
Okay, great. Very good. The social distancing stuff is just really hard anyway to slice it.
And there are some homes that within 6 feet is really hard to do. So we do the best that we can.
Yeah, exactly. I know in my own house, it's not the most open floor plan and spaces can be tight. So I can see how that would be a real challenge. The more people you add in and medical equipment, it's really, really challenging. So I'm not sure who I want to direct this next question to. I think I'm going to direct it to Lisa, but anybody feel free to chime in. Are you thinking about testing patients and family members before entering the home in the future when testing is more affordable, accessible, and our worlds start to open up and there's a bit more interaction?
That's not something that I've heard discussed at this time. Right now because we are now opening up for elective surgeries again, that were shut down, we are testing patients who are coming in for elective surgeries, not for emergencies, of course, but only for elective. So at this point, we're really not talking about that. Our families have been doing such a phenomenal job of staying isolated to protect their kids that it really hasn't been a concern. Honestly, we've had very few reports of family members reporting symptoms in any family members of our patients. So they're just really doing a great job of isolating. So I don't think it's something that we're really talking about at this point.
And this is Diane.
Diane.
Yeah, I was just going to chime in. It's a great question. I think the country at large right now is grappling with this testing issue and the lack of capacity to meet the demand, even for the frontline workers, the healthcare workers, and such. I think I would just say stay tuned. And there's also issues not just with capacity, but with some of the tests that are currently available, specifically the serological or the antibody test that, there's been little regulatory oversight, I'd say, and not meeting like high performance standards in terms of sensitivity and specificity. So I think, one, the capacity issues need to be addressed, but two, some of the technology definitely needs to improve, and also be available, and there's a lot of companies working on this, just at point of care, at home testing and things like that. So I think, stay tuned, and maybe this is something down the road when testing becomes more accessible and even possibly in the home environment. So we'll see. I love the topic, so I'll stop rambling right now.
No, I couldn't agree more with you, Diane. This is something that we've been talking a lot about internally at PPMD too. This is clearly a point of concern for the community. We're just curious. It's confusing, all of these false positive tests. It's just so hard to make sense of it. I know I personally have a hard time understanding a lot of the different terminology because it just seems like it conflicts, or it just doesn't make a whole lot of sense. And so one thing that we are in the early planning stages of doing that I can share with everybody is we're talking about what this looks like as far as an educational webinar for the community, so that we can understand just what is the science, how is it evolving, what does it mean, how is it relevant, how does it relate to us, what does access to this testing look like as we move forward. And I think too, I have to commend everybody on the phone. Particularly, it sounds like the folks at Cincinnati, I'm sure, are just, on par with all of the other hospitals, but they're being very adaptive and trying to make sound recommendations based on the information that we have available, which unfortunately isn't a ton. And so, being responsive to recommendations as they change and considering that, maybe testing isn't in the picture right now, but as the situation evolves and as we learn more and things become more accessible, I think that these are all conversations that we'll probably revisit once, twice, many times, and, make changes to our protocols as indicated and as necessary and as able to.
Yeah,
all right. Well, it looks... Go for it, John.
No, I was just going to say, so my background in molecular biology, I used to do assay development previously, and it's a very challenging field, and accuracy and validity is extremely important. And I think that obviously due to the challenges of today's world, a lot of these assays are being pushed forward very quickly. So I just want to agree with everyone and say that I certainly look forward to a future where these tests are more accurate, more valid, and also the reagents to make them are more readily available, because everyone around the world is looking for the same reagents or the ingredients to do these tests. So there are challenges coming from multiple areas. So I would agree, and we need to look forward to see how this plays out in the future.
It's just so stinking complicated, isn't it?
Yeah.
Thanks, John. That was really helpful. That was super insightful. All right. Well, it looks like at this point we've covered the real themes that have emerged from the questions that everybody has submitted. So thank you to everybody who did submit questions. If we did not answer your question to your satisfaction, please shoot me an email, rachel@parentprojectmd.org. I'm happy to continue this conversation, connect you with the resources that are helpful. If I can't answer your question, or if we at the care team can't answer your question in completion. Thank you so much for our speakers. John, Dan, Diane, Lisa, you guys were all wonderful and had such great perspectives and insight on a really, really complicated topic during a really complicated time. So thank you for that. I do want to plug a couple of different things. So we do have a Duchenne COVID-19 survey that we're currently in the process of collecting that's available through our website for parents to complete. Just helps to give us some insight into your experiences so far, whether it be through access to therapies, telehealth, just all of these different components from the pandemic that have just been really, it's turned our world upside down. And we're trying to understand in a more finite way how your world has been turned upside down, and then subsequently how we can support you best. So if you haven't and you're a parent or a patient, go ahead and go fill that survey out on the website. It'll be really helpful for us. Of course, we'll share information as we're able. And then we're also in the process of developing our next webinar, which is going to be about telehealth. I know that a lot of folks have already had telemedicine visits with their neuromuscular multidisciplinary teams. And for those of you who haven't, that's definitely probably good for you. That's definitely something that's on the horizon for a lot of us. So we are going to dive a little bit deeper into telehealth visits, what those look like, how to make the most of them, what questions to ask your provider, and get some good perspective from some different clinicians who are in the thick of providing telemedicine visits as well. So I think that'll be really cool. So keep your eyes peeled for a date and time on that. I think that about covers it. I mentioned this is recorded, so if you want to go back and listen again, this will be available on our website and on our YouTube channel if you want to listen or share it with families, friends, colleagues, whomever. And I think with that, we'll go ahead and call it a wrap. Thank you so much, everybody, for joining us today. Have a great rest of your weeks, and that will conclude today's recording. Thanks. Bye.